Right, I thought I'd do a little video on the medication I take and use and sort of try and describe to you what they are used for. Still Christmas, well, on past just Christmas, so Merry fucking Christmas. Right, start off with enzymes, bit supernatural, bit enzymes. Right, what these are for is when I was saying to you about my digestion, these help digest my food. They're the artificial enzymes because obviously I don't create them in my body, so we have to take artificial ones. So that's my Creon 10,000. I use these every time I eat. So if I have 7 meals, I've got to take these 7 times a day, and they can range between 4 tablets and 10 tablets depending what I eat. So that's the Creon. Then we have salt tablets, sodium salt tablets, because we sweat more than the average person. I think we sweat 3 to 4 times more than the average person, so we need to replace our salts because of that. Carbon cysteine, the old carbon cysteine, it's pretty much mucodine. Mucodine, what that does, that loosens up our mucus in our system, gets all the gunk out as much as possible. Never can say these Etromeprazole, they've got some really fucked up names. Basically, this is to do with heartburn. With a cystic fibrosis patient, we get acid reflux, so we have to treat that, because what happens is, I didn't realise this until I was in hospital earlier this year, that when we create acid, it comes up to the point where it can overfill into your lungs, which can create a bug problem. So didn't realise that, so that's the reason we have to take things for heartburn. Etrosol for liver, just because of the amount of shit we put through our liver, that sort of cleans it a little bit, helps it recover and everything like that, because of, like I said, the amount of shit we put through our bodies each day. Procolide, right, these are for women that have constipation. But we use these as a cystic fibrosis patient, right, because we do get clogged up. Well, obviously, the amount of stuff we put through our bodies, and we do clog up in our bowels quite often. So it's got to a point, because I do the bodybuilding and everything, and I eat about 7-8 times a day, I can have really bad blockages. And it gets to a point where it don't come out one end, but it comes out my mouth. So it's a bit disgusting. Deca, right. It sounds like a steroid, isn't it? You know what I mean? A bit of Deca. But no, what it is, it's our vitamins. We have actual vitamins dedicated for cystic fibrosis. They're the vitamins we can absorb the most, so they're purposes made for cystic fibrosis. Can't say these bastards, but these are an antibiotic. Just stops the bugs trying to get in. There's a more stronger antibiotic nowadays. Another antibiotic, anthramycin, and obviously the same again, stops bugs, because our immune systems are really down, really shattered. A bit of nasal spray, because we get clogging in our nostrils, because the amount of mucus we produce, we can clog into our sinuses, which I started to do, is get crazy headaches because you're blocked. Cipro. This little tablet is in case of an anthrax attack. You get treated by these. So basically, if there's an anthrax attack in this house, we are covered. But that is another antibiotic. When we get really poorly and we're just about to go on IVs, we try and stop it with this before we go on IVs. Sometimes it works, sometimes it don't. Foster, it's a steroid antibiotic for the lungs. My long period insulin, obviously at the morning I need it, because now I'm diabetic as well as all this, because of them tablets. these tablets go through our pancreas, kill our pancreas off, which develops a cystic fibrosis diabetes. So this is once in the morning and once at night. That is every time I eat. Every time, so I've got to count my carbs every time I eat. And then we go to the Toby Pod Inhaler. This is another antibiotic for our system, for our lungs. We try and prevent. It's a prevention to try and stop the bug growing too quick, too fast. But saying all this, the amount that we take to prevent bugs trying to get in our chest, if one wants to get in, it's going to get in. And then we have IV treatments, which I'm on at the moment, and I'll have to show you all them a bit later. But that is pretty much my tablets and what they do. There's my box full of them. I do bags nowadays. I bag them up for the morning. It takes a hell of a lot less time at my time. So if I dedicate one day a month to bag up all my medication, and then in the morning, instead of going through the whole lot, I just rip the bag open and take what's in the bag. Some of these you have to take twice a day. So obviously some of them I lay about, so I got them there ready to take twice a day. But I do red days and normal days because of the anthramycin. You need to take every other day. So I do these in red bags, so I know on Wednesday, Monday, Wednesday and Friday, take these. They're in my red days. But yeah, so that is the amount of stuff we have to take to keep our system running. Well, there you go. That's how much I take.